Hello everyone, and welcome back to Healix Zen, your ultimate destination for health, fitness, science, and mental wellness insights. Today, we're focusing on the recent health challenges faced by media icon Wendy Williams. In March 2025, Wendy made headlines when she was taken by ambulance from her assisted living facility after a wellness check was triggered by a handwritten plea for help. Emergency responders were called to her facility in Midtown Manhattan, and during her hospital visit, Wendy underwent a capacity test to assess her cognitive abilities. Remarkably, she scored a perfect 10 out of 10 on this test, a result that has sparked considerable debate among both her supporters and critics. Despite these seemingly positive findings, Wendy remains under a court-ordered guardianship that controls her finances and many aspects of her daily life. Her living situation has been described as isolating, with strict limitations on personal freedoms, which has led Wendy to publicly express feelings of being trapped. Although she vehemently denies being cognitively impaired, her medical team had diagnosed her in 2023 with primary progressive aphasia and frontotemporal dementia, conditions that have since become the center of media and legal controversies. Now, let's dive deeper into Wendy Williams' neurological condition and explore what primary progressive aphasia and frontotemporal dementia really mean, how they develop, and what current management options exist. Primary progressive aphasia, or PPA, is a neurological syndrome that primarily affects language abilities. It is characterized by a gradual decline in the ability to speak, understand, read, or write, which sets it apart from other forms of dementia that typically begin with memory loss. With PPA, the deterioration is slow and progressive. Over time, everyday communication becomes increasingly challenging. The condition often arises due to neurodegenerative processes affecting specific areas of the brain responsible for language, particularly in the left hemisphere. Closely related to PPA is frontotemporal dementia, or FTD, an umbrella term for a group of disorders that cause progressive nerve cell loss in the frontal and temporal lobes of the brain. These regions are critical for regulating behavior, personality, and language. As FTD progresses, individuals may experience drastic changes in behavior and personality, along with difficulties in communication, symptoms that overlap significantly with those seen in PPA. While the exact causes of these disorders are not fully understood, both genetic factors and abnormal protein accumulations, such as tau and TDP43 proteins, are believed to play a role. In some cases, there is a strong hereditary component, which means that family history can increase the risk of developing these conditions. Environmental factors and individual life choices may also influence the onset and progression of these diseases. Unfortunately, there is currently no cure for primary progressive aphasia or frontotemporal dementia. Treatment and management focus on supportive care aimed at maintaining quality of life and slowing the progression of symptoms. Speech and language therapy is one of the most important interventions for those with PPA. Such therapy helps patients retain their communication skills for as long as possible and can introduce alternative methods of communication when needed. Occupational and physical therapies also play a crucial role as they assist individuals in managing everyday tasks and maintaining their independence despite cognitive decline. Medications are sometimes used to manage behavioral symptoms or mood disturbances that often accompany these conditions. For example, antidepressants or drugs that reduce agitation might be prescribed, although these medications do not halt the progression of the underlying neurodegenerative process. In addition to direct therapeutic interventions, establishing a robust support network is essential. Caregivers, family members, and specialized community services provide both emotional support and practical assistance, which can make a significant difference in the day-to-day lives of those affected. Wendy Williams' case highlights a broader conversation about the challenges of diagnosing and managing neurodegenerative conditions. Her recent perfect score on the capacity test has raised questions about how these diseases manifest and whether standard evaluations can fully capture the complexities of conditions like PPA and FTD. It's important to note that cognitive abilities in individuals with neurodegenerative disorders can fluctuate, and a single test might not always reflect the overall trajectory of the disease. Furthermore, the controversy surrounding her guardianship, where legal decisions are made to protect her finances and well-being, brings to light ethical and practical issues. Balancing protection with personal autonomy is a significant challenge for caregivers and legal systems alike, and Wendy's situation serves as a potent reminder of the need for compassionate, individualized care. In summary, while Wendy Williams continues to make headlines with her recent hospital visit and the debate over her cognitive state, her diagnosis of primary progressive aphasia and frontotemporal dementia sheds light on the broader, complex issues related to neurological decline. These disorders not only impact language and behavior, but also challenge our healthcare and legal systems to adapt and respond in ways that uphold dignity and promote quality of life. As research continues and treatments evolve, Wendy's case reminds us of the importance of ongoing support, innovative care strategies, and policies that respect the rights and needs of individuals facing cognitive challenges. Thank you for watching this in-depth update on Wendy Williams' health. If you found this video informative, please give it a thumbs up, share it, and subscribe to Healix Zen for more insights into health, mental wellness, and scientific developments. Let's continue the conversation in the comments below. What do you think can be done to improve care and support for those with neurodegenerative diseases? Stay healthy, stay informed, and see you in the next video.